Approve the minutes from January 11th, 2022. All those in favor, please say aye.
Aye.
Any opposed? Okay, it's been accepted. All right, board matters. We have some field trips, a bunch of field trips coming.
Yes.
Very good.
It's exciting, Mr. Atkins.
How are y'all?
Great.
Very good.
Thank you.
The first trip is for band and chorus to go to King's Dominion. Shouldn't say Winterfest. It's in May. So band and chorus go to compete at King's Dominion. Second trip is a senior class trip. The senior class would like to take the students over spring break just one night to the Great Wolf Lodge in Williamsburg. Since it's an overnight trip, it has to get approved. And the third trip is DECA State Leadership Field Trip, and that's to the Virginia Beach area. That one is also an overnight trip. They qualified at the regional level, so now they'll compete at the state level, and that's 6 seniors.
Okay. Now, each one of these has to be approved separately.
Okay.
So, are there any questions on the King's Dominion field trip that any of you have?
You know, they're offering a date or of a range of dates, or we're
It's just
just
a date.
setting it up, just allowing them to
King's
go?
Dominion, I think it's May.
May 20th.
May 20th. It's a Friday.
Okay, Madam Chair, I move that we approve the trip to King's Dominion, Winterfest.
Second.
Okay. It's been moved and second to approve the DHS King's Dominion Winterfest field trip. All those in favor, please say aye.
Aye.
Aye. Okay, any opposed? Okay, that one's been approved. The senior class trip, and that's a day, one overnight.
Yeah, April 6th and April 7th.
What,
Any
back up
questions?
to where it is? Where are they going?
Great Wolf Lodge
At
in
Williamsburg.
And is that on spring break?
Yes.
Yes.
And my only concern on any of those would be, you got males and females, and how many bodies are you carrying with you?
She has it on the form. She has
Yes.
probably 10 staff members.
She has it
Yes,
right
she's
there.
right there.
She has it right here.
Yes.
She has about 10 staff members signed up, males and female staff members.
I'm at 11.
11, perfect.
That's awesome. Oh, look at all those people going. It's great.
And you've got an itinerary set, I saw, for every second of their day. Very good.
And they obviously need to be drilled in their head that, you know, school rules apply even though you're not at school.
Yes, and they do have some things that no, that's the other field trip. No, is that the one where they have to follow certain guidelines before they can go?
Yes.
Yeah. No ISS and stuff like that, yeah, for the pathway, yeah.
Yes.
Okay. Any other questions about that field trip?
I might want to, there's a good group of adults going. I said, we might want to go with
We
them.
might
'cause
wanna go with them.
That's a pretty good group of adults going.
Yeah.
It's like fun.
You all have to stay. Madam Chair, I move that we accept the senior class trip going to Great Wolf Lodge on April
6 and 7.
6 and
6 and
7.
7. Okay, do I have a second? Yeah. All right, it's been moved and second to approve the senior trip for the Great Wolf Lodge in Williamsburg. All those in favor, please say aye.
Aye.
Any opposed? All right. Now, the DECA trip, that's 6 members, right?
Yes, ma'am.
That, had competed and now they're going to the States
Yes,
for
ma'am.
competition. Okay? And
Is that overnight also?
That's overnight.
that's overnight. But that's Virginia Beach. Okay, any
Madam
other-
Chair, I move that we accept the DECA leadership field trip.
Okay, second, anybody?
Second.
All right. It's been moved and second to approve the DECA State Leadership Field Trip. All those in favor, please say aye.
Aye. Do you have a
Okay.
date on that?
Yeah.
March 4th through the 6th.
Okay,
Perfect. Thank you.
thank you.
Now Ms. Powell has. multiple
Yes.
field trips, yeah.
The next field trip.
Yes.
Good afternoon.
Good afternoon.
Before I get started, this is also National School Counseling Week. So I want to extend a huge shout out to all of our wonderful school counselors for all that they do for our students. Great job. So my first field trip is a secondary gifted field trip on Friday, April 15th to the Virginia Living Museum, Newport News, for the 6th and 7th grade gifted students. They will travel by charter bus, leaving at 7:35, returning at 4:30. They're planning for 28 children and 10 adults. The cost is $30 per student and $40 for adult. We do need your approval because the Virginia Living Museum is over 50 miles.
Any questions from anyone?
I don't have any questions. I think it's a great trip for the students, for the gifted students, and to see this, and it shows them that they are appreciated also. I think it's good in the pandemic, and I think it's excellent. And if nobody have any questions, am I in order, Madam Chair?
You are in order.
Well, I move that we approve the Virginia Living Museum trip for the gifted students.
Okay,
Second.
all right. It's been moved and seconded that we approve the field trip for the Virginia Living Museum. All those in favor, please say aye.
Aye.
Any opposed? Same sign. Okay,
Okay.
all right. Next
Thank
one.
you. Yes, ma'am. So the next request is also a secondary gifted field trip on Friday, April 29th to Busch Gardens in Williamsburg for Physics Day. This trip is for 21 gifted students in 8th grade. The students will travel by school bus this time, leaving at 7:45, returning at 4:30. They're expecting 21 students and 10 adults. The cost is $30 per student, $40 per adult. And again, we need your approval since Busch Gardens is over 50 miles slightly. Any questions?
Madam Chair, I move that we accept the field trip as presented to Busch Gardens, Williamsburg.
Second.
Okay, it's been moved and seconded to approve the Busch Gardens Williamsburg Physics Day field trip. All those in favor, please say aye.
Aye.
Okay.
Okay, thank you. Madam Chair, the next thing on our agenda, I guess it's going to be Ms. Austin's going to come and talk to us about the chiller at historic Southside Education Center.
Good afternoon.
Good afternoon.
I'm here to ask approval to remove and replace the chiller that's located at historic Southside High School Education Center. Make sure I said it right. Mr. Davis can answer the questions better than I can, but I can tell you that the chiller is not working right now, and it requires the refrigerant that is no longer being sold, and he's having a terrible time getting any of it fixed, to get. So I don't think it's working right now, right, Jimmy?
Right, it's offline, correct?
So
Meaning
the-
there's no heat, or
Just for cooling only. So
It's just a
good time of
cooler.
year to be offline.
Yes.
This is the time to fix it.
yeah.
The cost of this project is $304,763. So I do need your approval before we can move forward with this.
And this was actually a lot more than we had anticipated that it was going to cost. And right now, we really are at the mercy of vendors and contractors. And I think they have more work than they know what to do with in this moment. So that's what it's going to cost us, which is almost double what we thought we were going to have to pay originally.
Is this in our CIP?
This-
Yes, it's
This
part of
was in the
the
CIP
the
originally,
carryover.
but it was at a half the amount.
So we have to add to what we had already.
You approved last
Yeah.
time. Yes, ma'am.
Yeah, but we need to take care of this immediately.
I know we need approval for this, and I think we need to approve it now because you see, we've waited, and the longer we wait, the more the bill escalates.
Yeah.
And we do have a school in there, I believe.
Yes, we do.
So we're using it.
Several.
So if I'm in order, I move that we accept that, remove and replace chiller at historic Southside High School Historic Center.
Second.
Okay. It's been moved and second to remove and replace the chiller at historic Southside High School. All those in favor, please say aye.
Aye.
Any opposed? Okay, you've got it.
Thank you.
Ms. Haney, you remember the last time we were here, we tabled the meeting dates for some more discussion, so I know that you
Right.
wanted to have some discussion around the dates and times for the school board.
I will participate in the discussion. We've had our meetings, sometimes at 2 when we have discipline, sometimes at 3 when we don't, or we have 2 different meetings during the month. But the first meeting each month, we have typically had, we've had students a lot of times to come and present, activities from their school, and I know that last time when we were discussing this, there were like 30 kids in the room, and it was several groups we were recognizing. And for that reason, I was wanting to keep it at 4, because it's a more convenient time for students who came and department chairs who came and/or principals who came. However, I do know that there are people who want to do it later for just as good of reasons, but I just wanted to point out that the 4 o'clock time would accommodate those people. However, there are other people, so add to the discussion.
And I'd propose us doing the meetings an hour back where they would start at 5 for several reasons. And to be honest, one is due to my new employment as well. And also I've had parents tell me that it's 4 is too early for them the working parents to get off and come to attend our meetings. And we would hopefully see an increase, which I would love to see, this room full of parents, if we did move it to 5 p.m. That's why I asked for the increase, an hour increase to the meeting. But I do understand Ms. Pittman's as well. You know, for students it is, but for parents it's more productive at 5.
For me, I respectfully request that we continue our current times. I'm thinking about an agreement with Ms. Pittman that our students who attend and our employees who are here all day, and then they have to stay over to come to the meetings, and some have presentations, and I'd like to think about our students and our staff. I just think that it worked better, and I think that was one of the reasons why we changed it earlier, because our students had to go home and do homework. And the fact that we are able to do virtual meetings now, I thought that was a plus for our parents to be able to participate. And so I just respectfully disagree with changing it.
And on that point of parents participating, I wanted to ask, is there a way for parents to send a question or participate virtually, or if not, could we add that? If they were on virtual.
Some of the regional schools do it that way, I believe, like at Maggie Walker, I think they do it that way. They collect any questions prior to or any comments, and also at ARGS, they might do it as well. They read them at the board meeting, so if there's any statements or any questions.
Well, when we first started, when
do
we
that.
first had the pandemic, we had a 2-way setup, but that might be different than what we're using now. You know, Ms. Golson, at the beginning, or Ms. Clark, did we have something at the beginning where people could participate who were not here?
So now it's on YouTube,
Okay.
so
Is someone watching it, though? Is there a way for them to ask a question or sign up to speak?
well, I know what some other school divisions do is they set up an email
Okay,
and they email their questions in. But if, as far as a live,
Mhm.
you
Not
have a
really.
live Q&A, I don't, the comments are not on right now.
I would
And-
rather them
I don't
send
know
it
if
in
on this feature
and then
you
we
can
can all
post
see it.
And I will also add to the virtual piece. As board members, we know ourselves that when we had the virtual meetings, we struggled during our meetings, just in the areas we live. My district is very rural. Internet is very, very, very spotty. So that's another concern when we talk about virtual meetings, that, you know, the availability is not in our county. Point blank, it's not.
Well, a couple of things, and I do respect what Mr. Sneff is saying. A couple of things. We all have our telephone numbers are published, and people can call us. our emails are published and people can call us. And we encourage that. And we get some of that, but not nearly as much as we could. We want to hear when someone's concerned about something, has a problem with something, want to complain about something, make a suggestion. Those are the kind of things that we want people to contact us and the superintendent. So, and or if it stays at 4 or 5, either some way for people to send in a question over email that someone is checking that would then give those questions, no matter what time the meetings are, back to someone to have us answer them or address them.
So early on in the pandemic, we were using the info@dcpsnet.org. We
Mm-hmm.
used that email, and we got a lot of comments,
During the meeting?
During the
Yes.
meeting.
or in advance.
Yeah. Well,
So
I'd
that's
like
still
to see
active?
us, regardless of what time we vote on, to
And we can republish that again, and,
Right.
you know, if we need to make a flyer or whatever.
I thought about this over the last month about going forward or going later, and the other divisions, like Dr. Weston said, ARCS, Maggie Walker, Code RVA meet. Those schools we meet early in the morning, 9 o'clock, and we have parents to write their comments in or they email, and because at the end of each meeting, there are administrators who have other meetings to attend based on the time that the meeting is already set from 4 years. When the board comes in, that time is set. So it's very hard for, I'm using Dr. Weston as an example. I don't know what she has to do when she leaves, but there are those of us who have other meetings when we leave here that's set for years in advance it just goes on 8 o'clock. But so it's very hard to change, so I'm saying. So, but I am willing to take questions. As Ms. Pittman said, our phone numbers are listed. And then I'm sure administrative staff is willing to talk to you during the day or the time that you have off at special meetings. Because I do feel that it's very, it's not good to have our administrators, principals, and other leaders to get into school at 7 in the morning, and then they're still there, at a meeting at 8 o'clock at night, and then they have to drive 50 miles. Because, Dinwiddie doesn't house a lot of administrators because we're Dinwiddie. We just don't have that yet. So I at this time, I would vote that we keep the meeting time the way it is. And if nobody, may I make a motion?
I think so.
Madam Chair, I move that we accept the meeting dates that's on this 22 meeting dates calendar.
Second.
Now, if something, we can just discuss a little bit before we vote, correct? I just wanted to say, if something does come up and we have to, cancel a meeting, like we might not always have a meeting on the second meeting day of the month. That can happen, but these are just listed, as
The
dates.
second meeting is intended to be more of a work session for things that we are
Right.
doing, like the next meeting is about the budget.
Okay.
So I second the motion.
All right. It's been moved and second to accept the meeting dates for the school board as published. All those in favor, please say aye.
Aye.
Any opposed?
Nay.
Okay. It does pass.
All right. It's hard to believe that I'm going to say that it's been 2 years since we entered into what we've known to be as this pandemic. And as the pandemic has changed and evolved and the mitigation strategies have also, we've tried to evolve with it. And we've gone through quite a 2-year cycle. So tonight, Ms. Powell's going to come and bring to you some information about where we currently are and hopefully about what will take us into this next iteration to move from a pandemic to an endemic. And that's where we're, prayerfully, that's where we're headed next, yes.
Thank you, Dr. Weston.
Thank you.
It's my pleasure to present the health update this afternoon. On January 25th, 2022, the Virginia Department of Health announced it was changing from attempting to investigate every case of COVID-19 and trace all contacts to focusing on follow-up of outbreaks and cases in high-risk settings. So that's a big change for VDH. According to VDH, this response is more effective when a virus spreads very easily and quickly, and many infected people do not even have symptoms, such as we're experiencing with Omicron right now. Per VDH, Omicron is now the most common COVID-19 variant, and as variants change, so do the implications for our students. In March of 2020, so we're going back, COVID-19 was new, and there was a fear of the unknown. No one really knew what was going on, what to expect. Today, jump forward February of 2022, we have more detailed information about the different variants. In March of 2020, hospitalization was increasing. Today, hospitalizations are predominantly seen in cases for those with underlying health conditions and with non-vaccinated individuals. In March of 2020, when all this first began, we were focused on positivity rates, and that was our only focus of concern. Now the focus has transitioned to outbreaks and how we're going to handle those. In March of 2020, there was limited knowledge. Today, we have educated guidance. In March of 2020, there were no vaccines. Today, February 2022, we have vaccines for children 5 all the way up to adults. So we've come a long way in the past 2 years. Our focus has also changed. In March of 2020, our focus was on isolation and community transmission. Today, thankfully, our focus is on socialization and independent protection, such as vaccinations, staying home, getting tested when sick. And I think our parents are doing a great job of that. Although transmission remains high, the majority of the state, the Virginia Department of Health, has said there are multiple factors to consider in making recommendations for our students and our staff. Percent positivity is still one factor. Local transmission and disease trends, number of new cases in 7 days, incidence rate per 100,000, hospitalizations, outbreaks, vaccination status, quarantine numbers. For example, in Dinwiddie County Public Schools, we have quarantined over 2,000 students and staff since the beginning of the school year. That's 5 months. Some of our students and staff have had to quarantine more than once. So it's been a lot of missed time for students as well as staff. And then we have to consider the risk versus the benefit of wearing masks. There have been concerns about the mental health aspect of children wearing masks. And now there's an executive order from the governor stating that parents may elect for their children not to be subject to any mask mandate in effect at the child's school. One of the factors is percent positivity that we've already spoke about. If you're looking at that factor from the week of January 16th through January 22nd, our percent positivity in Dinwiddie was at 38.4%. Most recent data from January 30th through February 5th, we are down to 21.5% positivity. So as you can see, the percent positivity for Dinwiddie has gone down almost 15% in the past 2.5 weeks. The VDH presented information and new interim guidance for COVID-19 prevention in schools on January 26th, which includes letting us know that Omicron is now the most common COVID-19 variant and is spreading so quickly that it is not fruitful or possible to track every case in Virginia, according to VDH. Thanks to effective COVID-19 vaccines, most people getting infected with Omicron have mild illness now. Omicron is causing a very high number of cases, and this is putting a strain on our health care, from contact tracers to our wonderful school nurses to doctors' offices to clinics. Huge strain. VDH will now prioritize clusters, high-risk settings, and will continue to partner with K-12 schools to keep our community safe. Public health agencies are transitioning away from universal case investigation and contact tracing for individual cases of COVID-19. And that's within the last week or so. If you take a look, according to a news release on January 25th, 2022, the Virginia Department of Health stated the best way to protect yourself from serious illness and hospitalization from COVID-19 is to get vaccinated. And if you look, 55.8% of the total population in Dinwiddie County are fully vaccinated. For adults, 65.7% are fully vaccinated. Children ages 12 to 17, 35.8% are fully vaccinated. And for children ages 5 to 11, only 7.4% are fully vaccinated. The VDH does encourage people who have not gotten vaccinated or boosted and who are eligible to please do so. To assist in this effort, for anyone who is interested, we are hosting 2 upcoming vaccination clinics, one on February 17th at the high school from 4 to 6:30, and then a follow-up on March 10th from 4 to 6:30, again at the high school. And that is for students, staff, parents, community, anyone who is interested. They will have all vaccines as well as boosters for anyone who is interested in that. And this brings us to our recommendation. So it's our recommendation that Dinwiddie County Public Schools transition away from universal case investigation and contact tracing for individual cases of COVID-19 in conjunction with what VDH is doing at this time. It's also our recommendation that we report suspected outbreaks, which are 3 or more linked cases, to public health, and situations where the school has identified multiple cases comprising at least 10% of a specific core group. For example, a football team or softball team, something to that effect, or an individual class. Mask wearing, we are recommending that be optional for students. However, masks will continue to be required on school buses per federal order, and that's in effect till August of 22. And then lastly, per DOLE standards at this time, Virginia employees must wear masks indoors as long as the community is in a high transmission status. However, we do anticipate receiving an update to the DOLE standards within the next 30 days. So, any questions?
What is our date or recommendation? What are you proposing? I mean, we do have to get information out, I'm assuming.
Yeah, I would think so. We need some time to get the communication out.
So are we
So-
talking about doing it like in a week or?
I would say as soon as possible.
As soon
We're
as
ready to-
possible.
we're ready to go.
But how much time do you need to get the information out?
Yeah, Christie says she can do it as soon as you all need it to. I think.
Vote on it.
I think maybe it's
Like
more about
tomorrow.
the families needing the time,
Yeah.
because we've not taken a formal stance, or you all have not voted, and so I think it's more about them than it is about.
And
Well, I'm
students are
asking for you
still-
to
That's why we
recommend
did
for us a
Row One,
date.
too. We did remember Row One,
We did a
pushed
2 weeks.
it out,
Yeah. Was it 2 weeks or a week and a half
yeah,
or
something
something?
like that. I think we did Valentine's Day.
I have a
about that.
question. Without the contract tracing, how are we gonna find out where the outbreak, and how do you know there's an outbreak if people don't report it, if they think it's a common cold? So how are we gonna find that out?
Good question. So our parents will still call when there's a positive case. And they've been good about keeping their children home if they're sick. So hopefully they will call our wonderful school nurses and let them know that so-and-so tested positive. And as far as that information, they'll continue to keep up with the positives, and then we'll know if there are multiple positives within a class or within an organization or football team, basketball team, whatever.
We still have a dashboard that we're watching.
Yes.
Okay.
So we're not contract tracing, but we are, if the person tests positive, there's still regulations of how long they have to stay out and all that.
But that
we're
has changed, has it not?
Ma'am?
That has changed from 10 days to 5 days?
That's correct. That's correct. And we have kits, testing kits that, if someone comes up with symptoms, when the parent picks the child up, the nurse can ask if they would like to take home a COVID test. And, hopefully they will give us a call back and let us know. And they do for the most part. Am I right?
And the only students that would be quarantined would be household. I would assume the household would be quarantined, but we would not be quarantining other contacts, other close contacts,
Not even on teams,
unless it was an outbreak.
Outbreak.
unless you had outbreak, which is 3. Right.
Yeah,
3 or more.
three more. I will tell you, of the 2,000, we have quarantined a lot of healthy people over the course of 5 months, and we have a lot of kids that have been quarantined more than once, and that's been very difficult for them. And
That
the-
is.
The virtual piece of it is just, it's nice to say we can still learn virtually, but it doesn't work like that.
No, it doesn't.
It's very, very troubling. I just will say that this is difficult in this moment, because I think in this moment, even though I'm happy that we're getting to a moment where we can have a conversation about this, because there have been times when we couldn't even entertain this, but I feel so hopeful about the direction that we're moving, and I think even before the change to the DOLE standards come, it could be that our percentage rate will be so low that we will be out of that status. Because before Christmas, we were at like below 10%. Like, we were so low before Christmas in the community, which was great. It was the Christmas break that caused the spike up for us. But it's a tough moment to be in, because everybody's not in the same space as far as this goes. We've made this about a mask, but it's really bigger than that. And I'm really happy about all the mitigation strategies we have in place and everything the schools have done on the front end. And I can honestly say that I would not stand behind this recommendation if I felt in any way that it would be harmful to our students or our staff members. When I went out to meet with the teachers, what I said to them is this, that every piece of research that I've tried to put my hands on, and there's all kinds of conflicting research out there. Yes, no, kids don't need to wear a mask. If they wear it, they can't wear the N95. You need to wear the N95. There's a lot of conflicting research out there. But what I said to them is this, is that, I think that our young people, it's time for our young people or for their parents to have a choice whether or not they mask the kids or don't mask the kids. And we as the adults right now will make the same decision for ourselves, because we're in charge of ourselves. And we'll wear a tight-fitting mask. We're going to take care of our health. We're going to get vaccinated. We're going to do all the things that we need to do to keep ourselves safe. And we've also been working with some of our teachers that are in those have compromising health conditions. But I just want the people at home and the people in this room to know how difficult this is. And the reason that you see everybody here kind of wrestling is because we care about people. We care about young people, we care about grown people. And no matter which way it goes, somebody feels like you don't care about them. And that's hard, because that's not true. It's not true. It's just in this moment in time, this is where we are. And so I just want to put that out there.
And could you give us a few of the points on how we are helping the compromised teachers? We have some teachers who are taking chemo and have had
We are.
surgeries or leukemia or whatever. So what are we doing to make for that?
So it depends on their work location, but I know with teachers, they are gonna ask the students that actually are in that classroom to wear masks while they're in there because the teacher is such a high level of, the situation is so
vulnerability.
serious, right,
Right.
is so vulnerable. And so they've reached out to the kids and said, if you want to take this class, you're going to have to wear a mask while you're in there. They do have the teacher very isolated in the room. The teacher really wants to be there, so they're working with the families. I think for others, it's about help other people on the team. So if if the three of us were on a team and we're working, it might be that they take the in-person people and I do the stuff behind the scenes because I can't be around people, but I still want to come to work. So those are the kinds of things. They're taking it case by case. I don't think there's a blanket way in which they're doing it, but the principals are just meeting with each of their staff members individually to say, what would it take? Nobody's teleworking or anything like that. I know we have like even secretaries and all, we worked out things for everybody. This is how it's going to work when you interact with this individual to keep them safe.
So we are allowing the students, you mentioned that, they could change classes if they,
Yes.
so that's
Yeah.
been something that's been,
We will work with definitely, we always work with them in that regard, but certainly
if they're in those teachers' classrooms, they
Right.
can opt out of those and go to something.
Absolutely.
Yeah, or they could just wear the mask that one period and not wear it the
Yeah.
rest of the day.
Yeah, but that should be the choice of the
Yeah.
parents and students.
Yeah.
Right.
And
Not
we
being-
do have some
Yeah.
in-person virtual options that they can take at the school as well for some of the core classes. So, there's always a way to fit that in. It just, with certain teachers, it won't be an option in this moment because it's very important for them to be there and for us to keep them safe.
And I feel both sides of it. I definitely want both
absolutely.
sides to be represented in that.
Absolutely.
Not just staff,
Yes.
students as well.
Well, and how about if we have vulnerable students that were compromising health conditions?
Yeah, so we've had a couple of those already, when the governor's order initially came out. And so we have been able to work with a few of them to get them into virtual Virginia. So it just depends on their situation. Sometimes it's just about having a conversation with them and reassurances and hearing the teacher talk about what's in place in the classroom. And then we have had a couple that we've moved over to virtual Virginia.
Well, Dr. Weston, I feel very comfortable that y'all have tried and have done everything you can to make everyone as comfortable as possible and to be as safe as possible. And I think what y'all are recommending is good. I think that's, it's time for us to be there. And I know it's terrible when the kids were doing the contact tracing and y'all were putting everyone out. And, I know that when we went to Rwanda, the Prince George superintendent said she was told that a child was out 25 days and they were not sick, but because they were part of that contact tracing, they had to be put out. And another one was out for 20 days. And it's just, that's really tough on the children. And they need
Well,
to be in
it's
school.
it's changed. I mean,
Yes.
the Omicron is different.
Right.
When we were dealing with Delta, that
That was very-
different.
those were life
Yes.
threatening.
Very,
That
very
Omicron
different.
is different. So we can
Yeah.
do this now, but
Yep.
it is because the variant is different.
But
That's right.
also, I think, and what I've been, there's a lot about the mask wearing too. We have seen an increase in just mental health, challenges with our young people over the past 2 years, the isolation, what that's caused our young people, the number of kids that we're having to refer to counseling. If you remember when Angel Young Gill was here and she talked to us about the needs assessment with our young people, the number of kids that had thought about suicide over the past couple of years and felt depressed and anxious and all of those things. And so, I think, for me, having schools open, having it feel as much like school as we possibly can make school, I feel like we're in a good place to do that.
Are we gonna distance or we just, when you do this, we don't distance?
Yes, ma'am. So we'll continue the other mitigation strategies. Right now, it's 3 feet in the classroom. I will say, though, in some of those high school classrooms, when Mr. Garnes and I walked the other day, it just depends on the class. In some classrooms, you got 5 kids in there, but then in some classes, you might have 20 in there and they're big. So they do the best they can, but what we've told the teachers is to distance themselves, and the young people can do the same. Because we did talk about if young people who are wearing a mask don't necessarily want to be around somebody that is with, they can talk privately to the teacher about, I would rather sit somewhere else because I'd feel more comfortable. So it is about young people as well. Because not all the kids, I'm telling you, I don't know that all children, all the young people will take the mask off, because as I walk those hallways, the majority of kids are still wearing masks and choosing to do so.
And they have to wear it on the bus anyway to start with,
they
so
do.
they all should have a mask
They do.
with them.
I just thank you all for what you're doing to provide some type of normalcy for our staff and our students. You know, I have to admit, I'm like on the fence because
I know.
I'm not a doctor. I
know.
don't know science, so I have to go with what they say. But I am willing to try because I do think that things could be getting a little bit better. But I just thank the parents and the teachers for what they're doing to help our students and our staff stay safe.
And you know, I think my stance is, you know, like Miss Merritt and the rest of us, I'm willing to give it a try, but we're coming down and you know how people say you don't want to really eliminate something that's going good. That if we go, we take off and then we go back up. And so I would say, well, what would happen if we just stayed on until springtime when we got open? The weather's warm and be open. So I don't know that. I'm not a scientist, you know, I'm not a doctor, so I don't know. But and that's where my hesitancy come in, that we're on a good track now. We're coming down. Can we keep it down? So we don't know.
Well, I
But I
think
do
that
appreciate what you're doing and with what the data that they give you.
but I think the combination of more people being vaccinated, and I encourage those who made that choice to do that. And some people can't be vaccinated because of health reasons. Some people should be vaccinated because of health reasons. But combination of people getting vaccinated, some will choose to continue to wear masks. The Omicron being not as severe, and our rate coming down. I feel like we're in a good place now that we can make this decision. So therefore, I move that we accept the health debt plan. And I'm proposing a date of February 14th, but if that gives you enough time to get your information out.
It sounds like we've already done a lot of safeguards already to get the word out, and some like the staff and all are aware of the situation. It's upcoming, so I mean,
Right.
I'd be fine for it to take effect tonight myself.
I know.
There's no, the motion is the 14th, so somebody can either second it or not. Because other people need to adjust. Someone who's fearful of coming,
Well, I'm looking at
Without
principals because
mask.
they're the ones on the front lines that are gonna have, that's where
Yeah.
they're gonna take the brunt of it, so I think.
I think
is the
you need
14th
some prep
reasonable?
time. I don't know.
Is the 14th reasonable?
That's
They're-
next
they seem
Monday.
okay.
That's
They're
4
okay.
days. That gives you 4 days.
And it is Valentine's Day.
3 days.
3 days, actually. Wednesday, Thursday, Friday.
Yep. So
Is
there
that
a
enough
second to
time
that?
for someone who opposes being in the building with no mask
Okay.
to make adjustments?
It's been seconded.
Oh, they did? Okay,
Cheryl,
sorry.
second. Should we take a,
It's been motion and second, and you,
it's been motioned and moved and second. Do we just, all those in favor, say aye? Aye. Any opposed, same sign?
And we'll continue to bring you the
been
data
passed.
each time, just so you can kind of monitor the number of cases and what's going on with our positivity rate as well.
Okay.
Thank you.
Thank you very much, Ms. Powell. All right, superintendent matters now?
Yes, we're gonna have a CARES Act funding update. I think it's Christine.
Christie, both of you?
Yes.
I can do it. Okay, so I have this. All right, so last month we brought to you a presentation where we outlined all the CARES Act funding that we had received. And I promised that we would bring you any updates because we had 4 different things that were pending at that last meeting. And since the last meeting, some we even knew like the next few days, we did receive notification on all 4. So I've outlined here. So we did get final award on the HVAC project of $834,720. So, like you just heard on the replacement of the chiller at the historic South Side,
we are concerned, certainly concerned on this figure, to know we are well aware we're probably going to have to do more amendments once we get our figures, because I don't think our figures we have are going to work. I think we're really low on some of that, to be able to do some of that work. So we're going to have to go back in and amend some of those other ones we had shared with you. So that would be, once we get those figures of all those HVAC projects, we'll have to bring that back to you as well.
Is the price so high because the equipment's not available, or what's the issue?
I think it's equipment and labor. I think some of these places can name their price.
Labor is very high right
It's supply and demand,
Yeah.
and it's competition.
Everything's out.
Yes.
Goodness gracious.
And so it's affecting everything.
In addition, we also have to pay the Davis-Bacon wages for any CARES project, which if you're not familiar, what that means is you have to pay a regional, any contractor we hire has to pay the regional hourly rate for this area, which is usually above the market on any project.
Because it's federal
Because
money?
it's federal money.
Okay.
So that applies to every
Lovely.
single one of these grants for any
Yes.
work we have done. And we have to put a statement in every grant that we will abide by that. And it's, yeah. So the next one is the American Rescue Plan, the ESSER 3. That was the set-aside grants we had applied for. This was a competitive grant that we had submitted. So the summer learning, we can use this for any type of summer remediation, summer school. We can also combine this with regular state monies that we normally get for summer school. There are certain requirements of a time. We have to have so many hours for that one. So apparently a lot of people in the state applied for this and got it, because what happened was we got our grant approved,
But
but
less
then
money.
much less money. And this one, we had put in for summer school, summer learning for not even the summer, it's the next 2 summers following. So for that, between all of the things we had requested, we had asked for in the grant over $900,000, but we only got 180. So they had to divvy it all out once it came in. The same thing for before and after school. So this we're going to start, the plan for this when we put in the grant was to start this when school starts next year. And we know we have an earlier school start next year. And we can run this for a cycle of 2 years. And we requested 163,000, but we got 111. So we got most of what we asked for on this one. The next one, the American Rescue Plan, this was the homeless grant, and this was $15,369.51. Ms. Powell oversees this one, and this is just an award that was given, but it's still as a result of CARES Act funding. And then the last one, we talked about this at the last meeting as well, was the school bus driver incentive grant, where because of the size of our division, we could ask for 50,000, but apparently every school division did as well. So we got, of this amount we'll receive $13,682.33. That was a very popular number if you looked at the allocation. So a lot of people got the same figure. Like we shared in the last meeting, we still can proceed with what the plan was for that, to raise that hourly pay. We can supplement it with other funds, the other CARES funds or any local money. So that's still going to happen, but we can just put this toward it.
And
Okay.
this is a one-time
That was a one-time.
payment, but it would be also for our drivers? It would be like
So this was the intent of this one was to increase their hourly pay.
which would be continual.
And we could apply this toward it. You had a range of things you could do with it, but increasing the hourly pay was one. Some divisions opted to do just a bonus.
Yeah.
You could do it to pay for CDL licensure. It was a whole host of things that you could do with it.
And although I am in favor of increasing their hourly pay, then we will have to figure out where we get the money after
Right.
this grant runs out.
Yes,
We have a plan.
Christy's on it.
You have a plan?
she's on
We have a plan.
it. She's on it.
We're selling donuts, right?
Something, yes. So that's where we are at this moment in time. So we anticipate in the months coming forward, we will bring back any changes, additions. We are going to have to work on some amendments certainly to do that as well. Okay, but if you have any questions or feedback along the way, certainly let us know, because we can include that. We don't know just yet how much wiggle room we'll have to do other things. We're at the mercy of waiting on the HVAC things, because some of those are some very much needed projects that are old, so, okay.
And we're done with the south side's HVAC has already been installed?
We're done with it.
Okay. And paid for?
Well,
Maybe.
So the intent of this HVAC money was to do Sunnyside, Dinwiddie Elementary, and Midway, and the middle school, those four.
I don't think that they're completely off-site of Southside just yet, but
Yeah.
they do have it.
Oh, there's some other things on the list for there, yeah. So some other things were windows at different places. So windows could be opened up to have the fresh air come in. I know windows were there. We have some electrical work at different places. Lighting, those were in those projects. Okay. All right.
Okay.
I've asked
Thank
Christie
you.
to come forward. I'm going to be presenting the final budget on the 22nd, but I asked Christie if she could give you just an overview of where we stand currently.
All right.
Yes. Good evening.
Good evening.
The fiscal year 2023 budget is a work in progress at this time. So, but I'm going to provide you with an update of where we are at this time and ask for any feedback that you may have at this time. Dr. Weston will be presenting her proposed budget to you later this month. And this information is for the school operating fund only at this time. And this budget is not balanced at this moment. So we are still working to balance it. It's close, but we're still working to balance it. So I wanted you to understand that our work is not yet done. Compensation is the main focus of this year's budget. So, what did I do? Oh, there we go. Okay. All right, so we're going to talk about the revenue first. Our state revenue, we are proposing an ADM of 4,100 students. Currently, our ADM is sitting at 4,113, and that stands for average daily membership, and that is how we are funded by the state based on how many students we keep on our rolls all year long.
And what
This-
is our enrollment right now?
I'm sorry, what?
What is our enrollment right now?
4,000, well, our average daily membership is 4,113.
13.
Yes,
So we're
yes.
basing it below.
Yeah, it's slightly below, yes, ma'am. So, and also all of this state information, state revenue is based on the governor's budget. And we know that the General Assembly is still working through bills that have been introduced. There's still discussion on removal of the support cap, which would provide additional state funding to us. I believe I talked to you a little bit about that at last month's meeting. Crossover is February the 15th, which is next Tuesday, and hopefully we'll receive calculation templates for any changes based on both the House and Senate versions shortly thereafter. So we did have an increase to our local composite index, which increased very slightly. However, that it does have an effect, which means that we get less state funding because our locality has a higher ability to pay. We received $1.9 million in standards of quality re-benchmarking funds. The governor's budget maintains instructional VRS employer rate at 16.62%, which is the same as what we have paid for the last 2 years. The VRS board had recommended lowering that, but we're going to hold steady. It provides additional at-risk funding, which increases from this year at 26% to 49.5%, which is a significant increase. And it's $1.2 million for us. It must be spent on educationally at-risk students. It's based on the federal free lunch participants, and we do have to report how we're spending that. So we are being creative in what we're doing with our funding so that we can meet this requirement. It also expands our early reading intervention program, which we refer to as PALS, to 4th and 5th grade. So we are receiving some additional funding there as well. The main focus of the governor's budget was providing a 5% salary increase for SOQ funded positions each year of the biennium, which that means we received an increase of 1.28 million in state funding for this current year, and we'll receive additional funding for the FY24 year. So for our federal funding, we are anticipating a reduction of our Medicaid recovered cost of about $75,000. And this is due to reduction in services due to the pandemic. We anticipate that this will be a 1-year type thing and hopefully will rebound after that. We are also anticipating reduction of our E-rate recovered costs by about $10,000 because several years ago, we put out a RFP for internet service provider. We changed that to Chantel, and they offered us a much lower price for our internet services, and our E-rate is based on that. So therefore, we're not going to receive as big of a refund back on that. So all that said together, we're anticipating a revenue budget for our school operating fund of about $52,742,963, which is an increase of $3.3 million over FY 2022. Right now, we have level funding with the county, but note we have not balanced the budget at this time, so this may change. So just want to put that precursor in there. So moving on to our expenses. As we said, the biggest focus of our budget is based on compensation for our employees. So the governor's budget proposed a 5% salary increase, and we have put that in our budget. This brings our starting salary to $48,534. This comes at a cost of $1.2 million. However, we're still exploring some scenarios to possibly increase our starting salary above what we have proposed here. So more to come on that later. Our unified pay plan, the minimum wage is increasing to $12 an hour effective January the 1st, 2023. So we had to increase our grade 1, step 1 to $12 to meet that requirement in January. So the cost of doing that and moving all employees one step on the scale is $1,019,361. We increased the transportation scales to include a 5% increase with a step over the revised rates that we just changed last month in January. That was part of the grant that we were just talking about. So this did provide, it does provide an increase of anywhere from 10.5 to 12.79% over fiscal year 22 for bus drivers.
So back up to that, it says we increased the hourly rate, but we're moving them up a step.
Yes. Our bus driver scale and our teacher scale are both based on years experience. So there's a direct correlation between I've been driving a bus 15 years. So everybody driving a bus 15 years is paid the same thing. Just like teachers, every teacher who's teaching 20 years pays the same thing, is on the same
Scale.
So these, of course, every employee would move a step because they're gaining another year of experience and then we adjusted the scale by 5% over top of what we just changed it to last month. Okay. Now, none of these include any adjustments based on the recommendations from the compensation study that we're currently in the process of. Ms. Branch has received the draft of the compensation study results, and we will have more information on this in the coming weeks. We plan for Evergreen to be making a formal presentation to the school board in March sometime. So we are still working through this. She is still working through this. And so at this point in time, we haven't made any adjustments to any of those salary scales at this time. Health insurance. So our preliminary information is revealing an 18% increase. We will have more information in the coming weeks. Of course, we were not excited to see that number at all. But the cost, if Dinwiddie County Public Schools absorbed the entire increase, would be an additional $1.3 million in health insurance. And currently, we pay $4.5 million in health insurance costs now out of our budget. So that's a significant amount. But, you know, we don't think that the school division will be able to absorb this entire increase. But again, more information to come on this in the next few weeks.
So are we in a 2-year cycle, or that's from our current provider, or is that after we've gone out to bid?
Well, you want to talk about this?
Yeah, so earlier in the year, we did consider going out for bid. That was before we got the feedback from the local choice. So we've been with the local choice this time around for about 2 years. And the process involved with the local choice is that the costs are kind of spread across all of the divisions that participate in the program. So based on the preliminary information that we have, if we were to pull out of the local choice at this time, it would be a penalty for us because we spent out more in claims than we paid in at this point. So at this point, it wouldn't be wise for me to recommend that we go out for bid.
And we don't think we would get, you know, based on an 18% increase at this time, I mean, we're not in a market to probably put ourselves out for bid either, unfortunately. Yes, we're not very marketable health insurance wise at this point, unfortunately. So other information, just to wrap this up, currently we have not added any additional positions. We don't have any new initiatives in the budget. We have no increases to substitute expenditures or to supplements, which would include instructional or coaching. However, you know, we do know that there are areas in the budget that we are still looking at. You know, we can, you know, it's not, we still have some analysis still yet to do. And we're still reviewing the requested increases. We're evaluating the new position and reclassification requests. We're reviewing the results and implementation plan from the compensation study. You know, our next steps develop a balanced budget, determine the level of funding needed from the county in order to develop a balanced budget. And of course, as we mentioned, Dr. Weston will be presenting her budget to you on February 26, 2 weeks from today at 4 o'clock. And we do have a deadline to submit a request for local funding to the Board of Supervisors by February the 28th. Evergreen will be providing a formal presentation to you on the compensation study. Dr. Weston and I plan to go out and do school and department visits, so you want to join in the bandwagon. And then we have a joint meeting with the Board of Supervisors and the school board on March the 8th. And I don't think we have a time for that yet, do we? Okay, yeah. So that's what's going on in the near and dear future in regards to the budget. So I'll be glad to entertain any questions, get any feedback, you know, that you may have, or areas that you'd like for me to look at.
Well, when we say 5% increase and then it says starting salary at 48, that's two different things, right?
What do you mean?
Now, if you put a 5% increase to our current starting salary.
Well, the person that started teaching this year on entry level is going to get a 5% increase to move to 1 year of teaching experience.
Correct.
Okay, so the new beginning entry level is almost 5% above the existing of 46.5. It's not quite, but it's almost there. But we're hoping we can even up that.
Okay, so currently, last year's starting person was 46.
Yeah,
So
this
it's a
year's
little bit
current,
above
yeah,
that.
this year's current is 46.5, and we're proposing in this presentation 48.534.
Well, and the reason I'm asking that question, and I'd love for it to be higher than that, believe me, but I worry about the insurance piece. I mean, if we raise this over here and we pass the insurance piece completely on to our staff,
Right.
they may lose.
Right.
And so I want to look at that balance, and I'd love for it to be higher than 48, and but not at the cost of. If we can pass some of it on, not all of it on, I don't want them to lose
We can
lose the
maybe share
raise.
that with the board prior to the presentation, so
Yeah.
that you all have time to look at that.
Yes,
Prior
okay.
to the 22nd.
Well, and Dr. Weston and I had some preliminary talks about this as well, and we feel the same way. We know we can't pass the entire increase on to the employee. We don't want to do that. We want to find a happy medium somewhere.
Yeah, that's what I was
Hopefully.
suggesting. Right.
Hopefully.
Thank you.
So we'll make sure you do that.
Anybody have any questions, comments at this time?
I believe you're the last presentation.
Yes.
For the payroll and benefits changes.
Okay, now. Okay. So there are 3 significant changes related to employees' pay that I want to talk to you about today. And these are all proposals that we have for the upcoming year. So I'm going to go over each in detail with you, and of course we'll answer any questions you might have. Our plan is to communicate these to all employees towards the end of the month, maybe beginning of March. We're also, as I mentioned, planning to go visit the schools for budget updates, and this will be a great time to communicate these at that time as well. So the first one is our pay cycle changes. So with school starting in August for the upcoming school year, and employees reporting earlier than normal, most in early August, that is, there will need to be some adjustment in our payroll cycles. So currently, our 12-month employees are pretty easy. They start July 1st, they run through June 30th. They get their first paycheck at the end of July, and so forth throughout the year. Our 11-month employees are August through July. They report early August, so forth and so on. And our 10-month employees report in past years late August, but they don't receive their first paycheck until September 30th. So many of them report like August the 20th, and they get their first paycheck September 30th. Now, we have done some things to kind of negate that and help with that in August as well. But for the most part, they get their contract pay September through August. We are proposing to move this to August through July, because these employees are going to report to, 10-month teachers are going to report to work on August the 8th, right? I think that's right, August the 8th.
That's correct.
And so we are proposing that they would receive their first paycheck on their new contract as of August the 31st, as of this moment. So that is going to make many of them very happy, especially new teachers who come in and this is their first job. They don't have to wait 6 weeks to receive a paycheck. The 11-month employees, nothing is going to change for them. Nothing is going to change for the 12-month employees. It's only going to be the 10-month employees. And the good news, which is going to make every 10-month employee happy, is that means they're going to receive 2 paychecks this August, but only this August. It's not something moving forward, because they're going to receive their last paycheck from the contract year we're in, and they're going to receive their first paycheck from their new year contract. So I think that is going to be a positive thing for all 10-month employees.
So you're saying nothing's going to change for 12, meaning they'll be paid once a month, or they're being paid twice a month too?
Well, I'm going to get to that, Ms.
Oh,
Pittman.
sorry.
But right now, I'm talking about once a month pay. The changes from what we're currently doing to what we're proposing. So really, the only thing that the pay cycle is changing is for our 10-month employees. And we're just they're getting since they're coming to school or work earlier, they're going to start receiving their new contract pay a month earlier than they normally do. Doesn't cost anything. It's, no implications there. It's just going to be a little different in the way we do our contracts. So the second thing I want to talk about is related to VRS. So in 2013, the VRS started implementing the 5% employee contribution actually be paid by the employee. Prior to this time, what was considered the employee contribution was actually paid by Dinwiddie County Public Schools. And this was implemented in the early 1990s in lieu of a pay raise by school divisions. And I'm sure there's several of you in this room that remember when that happened. We implemented this 5% contribution. In 2013, when this change took place, when we had to start passing the 5% employee contribution back to employees, we did this in equal installments. We also provided a 5% increase to all employees to cover the cost of picking up having to pay the 5% at that time. VRS at this time did not really provide what I would call adequate guidance on how to implement some of this. What they wanted you to do is collect and report the employee based on their contracted months, which means that if you're a 10-month employee, they wanted you to collect the 5% over 10 paychecks and report to them in 10 monthly in your monthly reporting 10 times. However, when we did this, we were thinking it would be easier to the employee, and many school divisions across Virginia did the same thing, if we took the annual VRS pay and divided it by their 12 paychecks. Nothing it was the same every single month and nothing changed. However, over the last few years, VRS has been encouraging divisions to amend how they are collecting this and reporting this. They require that these be based on the contracted months of the employee. And now that they're mandating that we make these changes. And there are 24 divisions in Virginia left still doing this. Last time I looked, there might have been a couple that did it this year. But anyway, we are going to need to move forward with this. So what does this mean for employees? For 12-month employees, there is no change. 11-month employees, their deductions will be split over 11 paychecks instead of 12. For 10-month employees, they will be split over 10 months instead of 12. And I have a couple scenarios here for you, but I'd like to make a couple comments. These are basic scenarios proposed on salaries at this time, and they do not include any other deductions other than the 5% VRS. So they're just for show, so to speak. So here I'm showing an 11-month social worker on step 9 whose salary is $56. Their VRS, the 5% is $2,843.46. And in the first column over there, you can see their monthly gross. You can see the 5% over 12 months comes down to the same amount, $2,843, and their net pay comes out to $4,502. $502 every month. When we change it to taking their 5% over 11 months, they're showing a $21.54 reduction in their net pay every month until you get to the last month, in which there is no deduction taken from their check, and they see an increase of $236.96 in their paycheck. As you can tell, doing it both ways, we collect the same amount of money for their VRS contribution. Now, the last column, what I showed, and I know this is hard for everybody to see, but the last column, what I showed was what is the increase over this year over last year. And what you can see is, regardless, they're still going to see an increase in their paycheck. So it doesn't matter what month you are, what your salary is, you still will see, we're not decreasing your paycheck, even though we're changing this to 10 installments. The biggest thing is for 10-month employees, and I've given you a couple examples here of 10-year teachers, 5-year experience, I think 25 years, a paraprofessional, and a bus driver. And in each case, they're going to bring home more money. And they're not seeing a decrease in their paycheck. The difference is for a 10-month employee, their July and August check will not have their VRS deduction taken from it because we're going to have to take it over the 10 months.
So they'll have a bigger check in July and August.
Yeah, they'll have a bigger check in July and August, which, I guess, would be nice because a lot of times that's when people would like to have more money is during the summer.
Well, you probably aren't old enough to remember this, but we used to do insurance this way.
Well, I do remember this, right when I first came here. And because we offered employees a choice to receive their paycheck in 10 installments or 12 installments.
Well, and one time they took the insurance out in 10 and you got a higher pay in.
Right, that's why they had to do that, because some people didn't have 12 installments. Right. So, I think that this might be a little tricky for some employees to kind of understand, but I think because at the end of the day, this is a great year to do this because we are proposing significant increases. 5% is a pretty significant increase. So nobody is going to see their net pay go down. Okay.
I just want to say, and it makes no difference because don't have any state representatives in here, but just want to say, how short-sighted of this state to want to do this. People get paid in 12 months. And
I know.
It just doesn't make any sense to me. We have to do what they tell us to do, but it makes no sense to me.
I agree, Ms. Pittman. And, at the time, VRS, bless their hearts, they were struggling because they were getting a new system and, they were implementing these changes and you'd ask, and because we actually were doing it in 10 and we changed to 12 to make it better, thinking we were doing the right thing for the employees. And if we had known at the time, we would have done it that way from the beginning. But, nevertheless, we're going to do what they ask us to do because we like to follow the rules,
right,
and we'll move on. And it will also, I will say, it will also make it a lot easier for Mr. Wells and Ms. Stanfield because we do it a little off, it does require them every month to do some extra calculating and balancing because we don't match what the VRS report says because we're taking installments in 12 and they're showing what it's supposed to be in 10. So we that will help some too. All right. So does anybody have any questions about that? All right. And then the last thing that I have is about twice a month pay. So as you may have heard, the county had implemented twice a month pay effective last month, January 2022. So we are exploring the interest and ability to be able to also pay twice a month. There will be a survey going to all contracted employees tomorrow to garner some input. I want to just kind of touch on a few things that we feel are important about moving from once a month pay to twice a month pay. So twice a month pay would begin with the new contract year. So that would be July 1st, whenever you receive your first paycheck on the new contract year. Pay dates would move to the 15th of the month and the last banking calendar day each month. So if the 15th fell on a Sunday, payday would be on Friday the 13th. If the last day of the month fell on a Sunday, we get paid on that Friday as well, whether it's the 30th, the 31st, the 29th, whatever. Pay would be split evenly between 24 pay dates. Deductions would be split evenly over both checks. There would be no early pay in December. So currently, we pay on the last working day of the month. And so the last working day of the month in December is before we head home for the winter break. But, now that with electronic banking and the way things are, we really probably need to change that. And so we're proposing that we would do December the 15th and then December the 31st. So pay dates for this upcoming year would be Thursday, December the 15th and Friday, December the 30th. Substitutes, remediation pay, additional hours would all continue to be paid only once a month. We may look at that going down the road, but we are going to tackle this a little bit at a time. And right now, we feel like getting, if this is how it turns out, then we'll do contracted employees first. And then employees are going to need to do some things on their end by adjusting automatic payments, automatic deductions that they have coming out of their accounts in order to be able to, manage that across 2 paychecks instead of getting, all of their money up front, for the rest of the month. And also there are going to be some adjustments to, like if you have $500 going to in a savings account, you're going to need to, make that adjustment because you're not going to want $500 out of both checks. You're going to want $250. So there will be some things that the employee will need to work on as well. But this will go out tomorrow, and we will provide feedback to you at next month's meeting. They will receive the survey with all of this information in it as well, so they can, make an informed decision. And we're asking for them to just, yes, I'm really interested in this. No, I'm not interested in this, or it doesn't matter to me either way. So, and we will bring the results back to you at next month's meeting. So do you have any questions about this?
You're not going to allow some of them to be twice a month.
No,
It's
ma'am.
all going to be one.
It's
thing.
all or none.
Yes.
It is all or none.
Okay.
Well, I
Yes.
appreciate the fact you're surveying them, because I think some people will be delighted and some
Yes.
people
Yeah.
will not.
Yes.
Some people will
Yes,
not want to do
yes.
this.
Exactly.
So is this a proposal from the county, or this is something that they want us to do?
Oh, no, they did it themselves already.
Who did, the county?
Yes, they've already done it. They implemented it in January.
And we've had people to ask.
We have.
And so I'm anxious to see what the survey is going to.
Yeah, I am too. The last time we surveyed, it's been probably 15 years ago, maybe. But we did do a survey at that point in time along with the county, and actually the majority of the people wanted to stay with once a month.
Yeah, some of them, some comments I've heard, they've gotten used to it and they've got their bills all set up that way. But there are pros and cons for both. So.
Yes, there are. And like I said, there will be some work on the employees, and they're going to have to do that because, we're not going to be able to, do it for them, if they're not adjusting their banking. So, anyway, okay. Thank you very much.
Thank you.
Thank you.
All right, so that's all you have. All right, we have updates on ARGs.
Yes. I attended ARC's meeting this. I don't want to. Yeah, this dog. I attended ARC's meeting this month. No, last month in January, because at that time I was the vice chair of that board. So I'm no longer the vice chair, and I'm no longer the representative. So Ms. Merritt will be representing us from now on. But I do have the report from January. In January, all the students and staff at that time were required to wear masks unless eating, drinking, or there is a health issue with wearing a mask. The students in performance classes were able to practice without masks. That is, if they were in dance class, exercise, band, or playing instruments, only if there was 6 feet of distances between them. The teachers were making every effort that they could to make to stay 3 feet, to keep them 3 feet apart within their classes. And at that time, there were 84 students and staff who were taking advantage of weekly testing there in the school, and they were going along with the city of Petersburg was doing it for their students. And at that time, they had 12 positive COVID cases since school opening, and 8 of those cases occurred over winter break. And no positive cases at that time has been a result of exposure at the school. So we thought that was very good. And also, they're having the HVAC system there repaired and that is going to cost approximately $198,565.65. However, procrastinating has increased the cost of that particular job, and whenever it's done, it's going to be done. We're getting a grant. I think with the school would have to come up with $150,000. So prayerfully that will be getting done real soon. And that ends my ARCS report.
Okay. Well, the Rwani report, you want me to give it?
Mr. Sneff rotated off the Rwani board, and Ms. Haney and I are on the Rwani board. And we are beginning to look at the budget for that school. They are hosting a March 29th job fair, and last year they had to do it virtually. This year will actually be in person, so that's a plus. They are reporting that the registration for next year looks very good, and is particularly the CNA. They have an all-time high request for the CNA spots. We are moving ahead as fast as we can and trying to add plumbing to our curriculum. We are hoping to get it in for the next fall and be able to give students a choice in a timely manner for that. The board for Awanti did vote in this last meeting to offer the parent choice on mask. They were in a very difficult position. Prince George had not offered it. Sussex is having an outbreak and a huge amount, and we're keeping mask, and we were considering ours. So they had a hodgepodge of what was going on, but they said the students have been very cooperative and wearing them when asked to wear them. Ms. Haney, do you have anything to add?
Yes, they did reorganize and sort of kept the same thing. Ms. Pittman is still the chair for another year, and the superintendent from Prince George is the superintendent on record again for another year. And I think that's it.
In other words, I lost that election.
Yes.
I'm just kidding. No, we're working on some things that we wanted to keep the same and finished getting the plumbing in. So we left everything the same.
Okay. How about Code RVA? Did y'all?
Before I do Code RVA, we did reorganize at ARCS. Dot Hefner from Chesterfield is the chair, and Michael Netter from Amelia is the vice chair. Now Code RVA. That meeting was held on the wintry mix day, January 20th, at 9 a.m. We did a reorganization there of the board. Marcia Shea from Henrico is the chair, and Mr. Sterling Daniel from Hanover is the vice chair. Ms. Whitehead continues to be the board clerk. The director of Code RVA, in correction, we met at 11 o'clock. She gave us a quick overview of the mission of the school and the programs that are offered. And they're going to soon have applications reviewed for students who want to come there, attend, starting next year. And right now, they have 196 completed applications for admission. We're going to do the budget at our next meeting. It's scheduled for April, but it looks like we're going to have to come in a little bit earlier because April is pretty late to work on the budget. However, the director continues to look for other places to locate the school. And the school is, as Ms. Pittman had mentioned before, Ms. Haney, we're running out of money, so we're going to the state to request funds to keep the program because it is a very good program that we have there. So we will be meeting at a call meeting sometimes in February. And I did suggest that we try to keep them on the same day to make that trip for the two schools on the same
On one day, yes.
Yes. So that ends the Code RVA report.
And I would like to say that when the Code RVA started some years ago, they started off with a $6 million grant from the federal government, which was wonderful, but that's changed and dried up. So they're struggling with the funding
Yes.
piece. It is a wonderful opportunity for our students, so hopefully they can figure that out.
Okay, how about Maggie Walker?
Yes. Maggie Walker, 9 a.m. on that same winter day.
Yes.
We had election of officers. John Wright was elected the chair, Ken Pritchett vice chair. We didn't do too much that day. We met from 9 to 10. The girls who are on the cross country team won state championship. So they introduced themselves by locality. And I thought that was very good because we get to know if we have any students on these teams who are winning, and we can give a little extra cheer. So that was really a nice gesture, I think. The budget will be discussed at the February meeting, which will be on February the 17th. The International Language Fair would take place there in March. Right now, there's a very low infection rate, which we were glad to hear, and the students at that time will continue to wear a mask. And that ends my Maggie Walker report.
Thank you. All right, the next section is the citizens' comment, and we have 2 signed up. Before we do that, I guess I need to make sure that I let y'all know that when you come up, you need to state your name and your address. And during the forum, there's 3-minute is allocated for the public address portion for each person. Okay, so Kayana Man Warren.
I apologize.
I'm sorry.
Hi, how are you guys today?
Fine.
Great. Thank you so much for even coming here, being here, for serving. I did want to first start by saying that my family is...
Your name and address.
Oh, I'm sorry. Kiana Manwarren, address 3705 West Briar Lane, 23803.
Okay,
Sorry about that.
that's all right.
I wanted to say, hi, Dr. Weston. I've sent a couple emails to you, and I've spoken to Ms. Bonnie before, and I wanted to say thank you for you guys being so flexible through all of this with coronavirus, for you guys being so resilient and really caring about the kids and the parents and the families in this community. It does show. My family is not originally from here, but we did look all over this area to see what county we wanted to live in, and we picked here because everyone was so kind and everyone was so civil towards one another, regardless of backgrounds or regardless of differences. So I appreciate that. I did want to say that I am glad that we are moving beyond or trying our hardest to try to move beyond the mask and things like that. And I do pray constantly for everyone that is in this community, because I know we all are in different places, as Dr. Weston said. And that aside, since there's no need to really talk about that, I wanted to make just some points about the meeting time. I know that's already been voted on, and I just wanted to say that if there is ever an opportunity for that to ever be made more accessible to everyone in the county, Dinwiddie is a large county. I know you guys know that. I would love to see the room filled. There are a lot of parents who unfortunately have an idea that these things don't matter for them, that nothing will change if they come and speak. And I try to tell them, I've come to a couple of them, and you guys are incredibly receptive, that you guys are really knowledgeable and very much willing to hear us out. But 4 o'clock is difficult, and I'll tell you why. The buses, for us, we live 7 minutes away from where our daughters go to school. And on a good day, 3:45, they get home. And it's very rare because of all the situations with the buses. So just trying to get here by 4 o'clock is complicated. So maybe a little later, occasionally, maybe every once in a while having a meeting a little bit later would be greatly appreciated. So I wanted to say thank you again. We are grateful, regardless of things go our way at our household in this county. We are grateful because everyone has been very consistent with your kindness towards one another. And that means a lot, raising kids, because they get to see that. So thank you very much.
Thank you.
Thank you.
Okay, next one, Jessica Bray.
Hi, my name is Jessica Bray. I live at 714 Lou Jones Road. I just wanted to maybe suggest some things with school, with maybe having like a drop box for bullying, for children that get bullied. So maybe the children that are getting bullied they don't have the bully see them get bullied, maybe have like a drop box. And maybe, I don't know if there's any classes or like a course that the kids could do on educating children about being bullied. And if they may not know they're being bullied, or they may not know they are a bully. Maybe doing some classes, or something like that, because that's a huge concern for me and my family.
I appreciate you coming forward. Can I ask her a question?
Mhm.
Where do you go to school?
My son goes to
Okay.
the middle
Oh my
school.
gosh, you're so young looking. God bless you.
My son goes to middle school.
Okay. I know that our student advisory, our students here, they put a drop box at the high school for that very purpose, not for just bullying, but just for lots of things about
Okay.
if young people have questions, because sometimes you don't want to tell an adult, you'd rather have it, and that way the principal, I know they work with the principal to read the things that are in the box, and that certainly is something I know Mr. Walters would definitely entertain that, and
Okay.
because there are a lot of great things happening too, so it's, but it also gives you a place to put that information if you, would like to do that. I mean, you can certainly look at that for all schools. Has it been, have you had feedback from your? Yeah. It's a nice little mail, it looks really good.
It's some-
Mailbox in
It's
the
really
hallway.
discreet. We have it in a public place, where the main traffic in the high school is. So we like it. Again, it can be anonymous where you can put your name on it. So it's worked great for us. So I agree with Dr. Wilson's statement. I think if it was in all schools, I think that would be really cool.
Okay.
And I do like the idea too. I think education, we talk about this all the time, about just education, about what bullying is and what it is not, and we do need to make sure that we're being a little more, I guess, assertive in that area.
And it's a huge problem, especially at that age, and that doesn't mean we ignore it because it's that age, but it's something that we need to stay on top of, and it is a concern to parents and students, so we need to up our game with that. So thank you for coming forward.
You can continue
you.
talking.
And I'd like to, your secret news is what I want to know. Oh, my gracious. But thank you for coming today.
Thank you.
And I know Mr. Walters appreciates that. All the principals, we welcome your feedback always.
Thank
So
you.
Thank you for that.
Okay. And that's all we have for public comments? Okay. Board member comments? We want to start with Ms. Slit.
I kind of sort of made my statement earlier, but I do want to again congratulate Ms. Golson for school board clerk appreciation, because it's true. You'll always have our back. And congratulations to our school counselors for it being National School Counseling Week. And thank you for my gifts for Valentine's. It's appreciated. And I want to thank the parents who came out to voice your opinion. You are respected. And yes, I'd like to see more of that. Thank you.
Ms. Merritt has said a good bit of what I would like to say, and I'm not going to repeat it. But I do appreciate each person coming out, and especially the parents, because you loan your children to us daily for us to educate them, and we pray that we do a good job. We think we do. And we do appreciate each of you for coming and voicing your opinions as what you want us to do, because I think it's no better than having parents, school board working together. So we do appreciate that. And counselors, thank you. Bonnie, you are a jewel. The same thing she does for Dr. Weston, she does for us. We go to meetings, we have our books, we have everything all printed, and the other people look at us and they'll sort of snarl because we have Bonnie. But we do appreciate it. Thank you, and each of you have a good night and stay warm.
Okay, Ms. Pittman?
I'd say Bonnie is a jewel, but she's also the glue that keeps us together, keeps us informed, make sure each knows what the other's handling and doing with, and she's so appreciated. So thank you. I also we thank you all for the gifts and acknowledging us being on the board. I always feel so bad when they do it because I feel like we should be doing it to somebody else. But thank you for acknowledging that. And as we move forward with the mask situation, you know, things have changed. We're going to change, and hopefully we're turning the corner, and hopefully the spring will be better. Jay?
I also like to thank Bonnie for everything she's done and continues to do on a daily basis. You know, without you, we would definitely be more lost than we are sometimes. And I like to thank the fellow board members for all that hard work they've done. Appreciate, you know, going forth with getting rid of these masks, better terms. Been waiting for this day to happen for a while. Thank the parents. I love seeing parents in meeting. You know, I look at it as we work for the parents, and they are number one priority above the students first, and the parents need, you know, y'all are the ones that give us the information, let us know how what the community needs. Students, they let us know what they need, but we also need to know what the community needs. So thank y'all for everything y'all have done, and the appreciation really should go to y'all and the students and staff, not so much board members, because without y'all, we couldn't do it, that's for sure. So thanks, everyone.
And I would like to just say, thank you very much, Bonnie. We really appreciate you. Don't know how much. And really appreciate all the recognition and the gifts that, you know, we were given today. And anxious to go home and look at them, because now all we've seen is the bag. I want to see what we got. But also, I was very glad to see the field trips coming back and the kids getting more back to normal. And I think the mask mandate kind of lifting a little bit is going to help out too. And like they all said, the parents being here, that's what we're here for, to help y'all with anything that you need and work with you. And our student representatives.
I wanted to firstly say thank you to everyone on the board and the clerk for. Okay, now it's working. Firstly, I wanted to say thank you to everyone that is on the board as well as the clerk for being here and making sure that the board runs as it's supposed to. I also wanted to say thank you to everyone who gave citizen comments today. I really appreciate your feedback, and so does everyone else on the board. And also a thank you to school counselors, whether they're at the high school or all schools in our district. You're very appreciated. Thank you. And thirdly, I wanted to update everyone on Claire and I's reform of dress code at our high school. We're almost complete, but we will soon have information to relay to the public soon. Thank you.
Okay, I have a lot of comments. Well, it's not a lot, but I have some things to say. First off, I want to thank y'all for our gifts. That was very nice. Second, I think it's extremely important that you brought up the fact of bullying. Now in current ages, because of social media, bullying has become 100 times bigger than what it once was. Last year in our advisory group with Dr. Weston, when we did Zoom calls, we did a Zoom call one day, and there were about 20 to 30 kids on there, and she just asked free for all. And one of the main things that kids said was about social media, bullying, and mental health and how they coincide with one another. So I think it's really important that the school is acknowledging this and starting to stop it, because it is a really big issue between kids, whether they want to say it or not, or speak it with their parents. I've been very open about mine with my parents, and we have open conversations. But some parents students don't have that luxury. So I think it's really important that we start addressing it in school too. The mask, I think it's very encouraging to see that the world is turning back to the way it once was. At the high school right now, where Mr. Garnes has allowed us to start eating at the high school, in the cafeteria. And yeah, in the cafeteria.
She qualified it,
yes. In the cafeteria. And I was really scared since this is my senior year that I wasn't going to be able to do that. So it's really cool that that's happening again. Also, what Dr. Weston said about the mask. My second period teacher lives with a woman who has stage 4 cancer, and when he was talking about the masks a couple weeks, he was like, I can't persuade you to wear masks anyway, but I'm telling my story and I'm going to let you choose. And personally, I'm vaccinated and I believe vaccines works. I'm pro-vaccines. So when the board said, I've respected the board's decision so far, so I've been wearing my mask in school, but tonight when you made the comment, I plan on not wearing my mask in school, but for his class, since he has asked respectfully, I'm using my human decency, and I'm going to wear my mask in his class because that's what he wants. So I think that, yes, everyone has a choice, but I think we all need to use kindness, whether that be on social media or any other thing, because with recent events, there's been a lot of hatred on social media, and I think that that shows our young people a lot of things. So, sorry. I just think people should start being nicer.
Thank you, Claire.
Madam Chair,
Yes, ma'am.
I can't sit here and not say anything because I sit here every month and I watch these young ladies. And I just want to tell you publicly that I'm very proud of you two. You're the type of leadership that we're going to need in the future. Yes, and I applaud you. Thank you so much.
All right, now, superintendent
I don't even
comments.
think I can't even speak after that. I just would, echo what Claire just said, because I wrote down compassion and kindness, and, and I think that the world can just use a lot of that these days. And regardless of where you sit and what you believe or what you think, and, where your zip code is, where you go to church, it doesn't matter. If we all could just be a little more kind and compassionate to one another and respectful of people's choices. And you're right, Claire, that, our young people are watching us, and to see how they're supposed to navigate the world, right? And so we have to give them good role models for that, especially in those moments of adversity when we don't agree. And so I would just, challenge us all to go out this week to do just that. And as we go back to our workspaces tomorrow and into our classes tomorrow. Our new governor, I think intentions were good, and has put forth a tip line. I'm sure you've all heard about it. And the tip line was intended to be able to identify divisiveness happening in our classrooms or in our schools. And I don't think his intention was, I don't think there was any negative, he didn't intend for it to be anything negative. But what I would challenge us all in this moment of compassion and kindness, and with it being Valentine's Day, I would challenge people to use that tip line to talk about the people that we have the opportunity to work with and live alongside, and to experience from the people that are uniting us in these moments, in these past 2 years that we've been together, and talk about those stories, because we do have a lot to celebrate in this county, and we need to tell our story and not let other people tell our story. And so that's all I have to say this evening.
Thank you. Any other comments? All right, do I have a motion to adjourn?
Madam Chair, I move that we adjourn the meeting.
Second.
Okay. Meeting's adjourned.
All in favor?
All in favor, say aye.
Aye.
Any opposed?